There are big changes happening to 2025 Medicare Part D drug plans. And in this video, I want to share with you the initial findings that we are having when it comes to Part D drug plans so that you can both save yourself money, but also to avoid surprises when it comes to your drug coverage. So in this video, let's hop into what those things are so that you know what to look for and again, ultimately have the best healthcare for when it comes to Medicare. I'm Emily with the Medicare Coach. We are an independent consultant helping our clients navigate both the Medicare rules through the government as well as insurance company options. We are not an insurance company, an insurance agent, the government, none of those people. We are here to truly be your advocate to help you through Medicare. So at this point in time, we have done around 500 reviews for our clients. We're sitting at the early end of October. And I want to share those initial findings. We have a couple thousand more to go, but I'm seeing a trend that I want to share with you, whether you're joining Medicare in 2025 or whether you're here with me in 2024 at the end of 2024 and you're trying to finalize what your best plan is for the new year. So initially, we are seeing that over 50% of our clients are changing Medicare Part D drug plans. The average savings is around $900 as we currently sit. It is not abnormal at all for me to see a client that we're saving $1,000 for. So there's some big changes that are happening. They're kind of driving these cost differences, these changes that I want you to be aware of. And the first one is pharmacies. We are seeing that a lot of pharmacies are either moving in network or out of network. And by changing pharmacies, people are having significant savings. As of 2025, there's a few bigger changes. I think one of them driving the pharmacy impact is a payment plan option. So there is a program in 2025 where you can basically create a payment plan for your medication copays that are approved by your Part D drug plans. And by doing so, you pay the pharmacy nothing, but then you pay your Part D company something. And our hypothesis is that because of this payment plan structure, a lot of these smaller pharmacies are leaving the bigger companies in their networks. And so if people are at smaller pharmacies, one, you can stay. We're happy to support that and do that research to help you stay at your current small pharmacy. Or two, there can be options to change to other companies. I had a client who could save $3,000 by changing pharmacies, or even just $2,000 by staying at the same pharmacy but switching Part D drug plans. And so if you're at a small pharmacy, it's just something, one, definitely look at your Part D drug plans. But two, there can be some things. Again, I love supporting small pharmacies, so I'm not opposed to that. But I want you to at least be aware of the pharmacy implication for Part D drug plans. We are also seeing that a company called SilverScript, which is through Aetna, is getting quite expensive this year. Last year in 2024, SilverScript made sense for a lot of people. We're finding that a lot of people are leaving SilverScript. It can still make sense for some people in some areas with some medications in some pharmacies, but SilverScript is one of the ones that we're seeing a lot of changes out of when it comes to Part D drug plans. We're also seeing people join WellCare or switch WellCare plans. I'm seeing some publications out there from especially insurance agents who are kind of not talking very kindly about WellCare, and I get it from their perspective. They're not getting a ton of commissions or sometimes even no commissions on those plans, or they're not being contracted with them. And so there can be some downside to that, but I still like WellCare for the right person, the right medications, the right pharmacy. And we're seeing people, I had a client this morning who could save over $1,000 by going to WellCare. I had another client, though, who could save $1,000 by leaving WellCare. And so it's really up to you, but I don't think that WellCare deserves a blanket do not join them approach. I get why agents are disappointed that they're not getting contracted with, they don't get the commissions. But I think for you, the individual, if your goal is to save the most money, that WellCare can absolutely make sense in many situations. We're also seeing other companies get on that WellCare low premium bandwagon. We're seeing other companies offer zero premium plans, which I think is great because as of this year, when we have that cap of $2,000 for your medication copays, and many times those low premium plans are your best option because you already have a cap when it comes to your medication. So that's something to look out for when you have expensive medications. We're also seeing that states like New York and California are getting really expensive for Part D drug plans, which I think is unfortunate. I had a client whose premium went from $3 a month in 2024 to $32 a month in 2025. And that 32-month plan is the cheapest one that we can find for her. And so we're having other conversations because in states like New York, you have those unique insurability rules where we can make some changes. But I think the key is if you're in New York or California, there can be some shocking changes to your premium. So be aware of that. So again, we're seeing changes across the board. I was hoping, last year we kind of more of a trend in who's changing plans. And in 2025, it's kind of like everyone. It's a bit of a free-for-all. And so if you're on Medicare right now, as I'm filming this in October of 2024, please review your drug plan for 2025. Again, there are significant changes, and if you don't make those changes now, it can cost you a lot of money. And if you're joining Medicare for the first time in 2025, please do your thorough research, understand your pharmacies, your medications, your different options, and make the right decision to save you money, because there can be significant cost differences. I mean, thousands of dollars in cost differences when it comes to these drug plans. So hope you found this helpful. I will share some extra resources in the comments below, but make sure you like this video for more inside tips to help you easily make your right Medicare decision.